Some breaking news in the last half hour. Buckingham Palace has announced that the King will go to hospital next week for treatment on an enlarged prostate. They say that the condition is benign, but he will undergo a corrective procedure. He will postpone public engagements for a short while he recovers. Now, this news has come as a particular shock because it follows just an hour after Kensington Palace announced that the Princess of Wales is recovering in hospital after having what the palace has described as successful abdominal surgery. She's expected to stay there for the next 10 to 14 days to recuperate and is unlikely to resume her royal duties before Easter after having the planned operation. Prince William is also cancelling a number of his public engagements while Kate's in hospital in order to care for her and their 3 children. Joining me now to discuss this, all in something of a rush because it's all been a bit of a surprise for everybody concerned, is talkTV's royal editor Sarah Hewson. We're also joined by NHS GP Dr. Kaye. We'll start with you, Sarah, because this hasn't been announced in advance. Nobody knew about
we
this
didn't
until
know
today.
about this. Yeah. So around 2 o'clock today, we had the statement from Kensington Palace that the Princess of Wales had been admitted yesterday to the London Clinic, a private hospital in central London, for what was described as planned abdominal surgery that was successful. She's due to stay in hospital for 10 to 14 days. So while we don't quite rightly know the details of her condition, we can deduce from that it was major surgery to keep her in hospital for a significant period of time.
Yes.
And then she's going to return to Adelaide Cottage in Windsor, their home, where she'll continue to recuperate for a period of 2 to 3 months. So it is likely to be Easter at least before she is back on public duties. And then in the last 20 minutes or so, we've had the news that the King is to attend hospital next week for a corrective procedure on an enlarged prostate, a benign enlarged prostate. Buckingham Palace stressing this is a common condition for men of
Definitely
his age.
true. Lots of people watching and listening will agree. It's
Will
a very
certainly
common
agree.
condition,
And actually that the King was very keen for this information to be out there in order to encourage other men to seek treatment should they need it.
Yes, it's a very good idea to communicate this and to get the information out there. However, you might have thought that maybe Buckingham Palace might hold off on this information about the King, or even that the King might delay the procedure for a couple of weeks just because of the impact and the shock of the announcement of the Princess of Wales's abdominal surgery, which has blindsided everybody and nobody was expecting. And she's a 42-year-old mother of 3. You might have thought they might have thought, let's not give the country an onslaught of royal medical problems and situations all at once.
Well, I suppose the most important thing is that they are both getting the best possible medical care that they can be. The Princess of Wales recovering and the King responding to symptoms and getting the treatment that he needs as soon as he needs it. I know Philippa will tell us more about his condition. Yes. He too is going to be postponing public engagements, but for a short period of time while he recuperates. And he's 75 years old, but he's in pretty good health, full of energy. And I think that while he recuperates, he'll be back to work as soon as the doctors possibly advise him to do so. But while he is off duty, he will still be receiving those red boxes every single day and conducting all of the work that he can do whilst not necessarily appearing in public. But we've also got Prince William, who's going to be taking time off as well to look after Kate, dividing his time between being in hospital with her over the next 2 weeks and also looking after their 3 young children back in Windsor. They like to be there for the school run. They want to be there for their children. Obviously, it's very unsettling to have mummy taken out of the equation for 2 weeks.
Very much
and so I think they'll be very, very keen to maintain as much normality for the children as possible.
Unfortunately, the Middletons live nearby Kate's parents, and so they have always helped with childcare.
Very hands-on grandparents, and I think this is where they will really be relied on to give an extra pair of hands and some extra support to the family.
All right, I'll come back to you in a minute, Sarah, but let's have a word with Dr. Kaye about both these stories. Philippa, thank you very much for joining us. Let's start with the King. So this is an enlarged prostate gland. He's a man of 75. He's deliberately giving this information in this much detail so that other men will be inspired to seek this treatment, because it's very important to get something like this seen to and diagnosed as early as you possibly can. So tell us a bit about the prostate, where it is, what it is, and why the King is doing the right thing, not only in doing this, but in making sure we all know he's doing it.
The prostate gland is a gland which is about the size of a walnut, and it wraps around the urethra, which is the tube that carries urine from your bladder out to the toilet. And its job is that it makes some of the fluid that makes up semen. And as you get older, it is very common for the prostate gland to become enlarged. But if you think about that walnut with the tube in the middle, as the walnut gets larger, it squashes that tube. And that's what causes the symptoms. So common that about 50% of men over 50, but all the way up to about 90% of men over the age of 90 will have some degree of benign prostatic enlargement. And those symptoms might be that you are peeing more frequently than normal. You might be getting up in the night multiple times to pass urine. When you start to go, there might be some hesitation. Oh, I can't quite go, now I'm going. The flow might not be as good as it was before, and there might be some dribbling afterwards when you think that you've finished, or that you feel that you haven't completely emptied your bladder. Now, what's really important is that if men are having these symptoms, that they go to the doctor, because those symptoms could also be signs of prostatic cancer. And when it comes to cancer, we obviously want to treat as early as we can. But benign prostatic hypertrophy, when it gets enlarged, is very big. There are medications that is very common. There are medications that we can use, and if they stop working or if they aren't enough, then there are some surgical procedures. And the commonest one is a transurethral restriction of the prostate. And that's when a very small tube with a camera and a light is passed through the urethra. So isn't even a cut to the skin. Sorry, there isn't even a cut to the skin. And then some of the prostate is removed. And the recovery from that is generally 1 to 3 days or so.
Right, let's move on to the Princess of Wales. Now, this is a very different kettle of fish in that, you know, it's quite important, well, not very, very important, really, for us all to respect her privacy in this, not to kind of intrude or try to obtrude into the details of what has been described as a successful abdominal operation. She's a mother of 3. She's only 42 years old. I think the thing that lots of people are thinking and feeling is, first of all, you know, let's pray that she recovers fully and you know, is already beginning to bounce back after the operation. That's the first thing, of course, and sending love to the family and to her children and her parents and her husband, everybody else. But secondly, that 2 weeks in hospital, followed by a good sort of 3 to 4 months off work, probably denotes that this might be a rather more serious operation stroke procedure than people would be wishing a 42-year-old mother of 3 would be having to undergo.
Absolutely. And as a mum of 3 myself who had a major surgery that meant leaving my 3 children, I absolutely feel for her and her children. And I'm very grateful that they do have local grandparents, and I'm sure that they have a great support network to help them. The truth is that if you're in hospital for up to 14 days, that means that that's a major surgery, and that you need that support for a prolonged period of time. We know that it's an abdominal surgery, but your abdomen is a big place with lots of organs involved. And I believe that I read that they were told that it was a non-cancerous surgery. But if you do have a major abdominal surgery, it does take a long period of time at home, even after the operation, to recover. And that will be often related to the size of the incision as your muscles heal and stitch together. But this definitely sounds like it is a big surgery, and I wish her all the best.
Well, thank you very much indeed, Dr. Philippa Kaye, and I'm sure that's exactly how we feel. We wish her all the best. I mean, I think obviously one of the things that's kind of heartwarming about this is the absolute kind of unflinching desire of her husband, Prince William, to be with her and to be at her side and to put her front and centre and his children front and centre. And that's something that's not showy. It's not for public kind of approbation. It's because that's how he really feels about her.
Yes, and he may be heir to the throne, and they may be senior members of the royal family, but they're also a family with young children as well. They're very hands-on parents, and I think their first priority right now will be Kate's health, her well-being, and the well-being of their children, and making sure that as much normality is maintained for them as is at all possible.
Absolutely. I mean, obviously, we wish her a speedy recovery.
Certainly
and
do.
Send her our very best wishes and
Yes.
and you know and love and appreciation. It's kind of quite sort of shocking to the system to think of her in hospital recovering from major abdominal surgery, because before Christmas, particularly, she was very visible, wasn't she? She was doing all sorts of different engagements, and she was wearing jeans, and she was wearing tracksuits, and she was running and catching and playing with little children. And she really was working hard, and we saw a lot of her.
Extremely active,
Yeah.
very fit, and hopefully that will stand her in good stead for her recovery. But yes, she'd been very visible, very prominent, very busy in the months leading up to Christmas. Last time we saw her was at Sandringham on Christmas Day. We were expecting a similar pattern of engagements leading up over the coming months, continuing her work on the early years, talk of an overseas tour, for example. Those have all had to be postponed for now.